my name is Kelly Ball. I'm a student physical therapist in my clinical rotation at Lott Physical Therapy in Corsicana, Texas. And this is going to be my in-service project. It's going to be a YouTube series, 4-part videos over the treatment paradigm that I learned from my clinical instructor, Dr. Jacob Rash. And so we're going to go ahead and move into part 1 today. It's just going to be explaining kind of the purpose of a treatment paradigm and what it is. So we'll start right there. What is a treatment paradigm? It's really just the organization of how you're setting up your treatment sessions in order to maximize the benefits each minute the patient is there. So why use this idea of a treatment paradigm? Like I stated before, it's really to make the most of your treatment sessions in order to make them more effective for that patient. And another good thing about the treatment paradigm is it really keeps you thinking continuously about why you're doing things. It makes you think about, why are you doing it at this time during the treatment session? Are you just bouncing around from equipment to equipment because it's open? Or are you really doing it at that specific time to reinforce or strengthen that particular deficit? It also allows you to self-evaluate. Sometimes we get into these ruts and we're like, oh, that person has low back pain, so I'm going to be doing this, and this. Well, that's not really specific to the patient, and we might not be doing the patient the best benefits we can give them. I think this will be really good for new students who are coming into the field because in school you're thrown all this information. Here's your special test, here are some exercises you can do for this thing, but you really don't set up a treatment session fully until you start seeing patients. And so this will help you ask, why am I doing this, especially in those first couple years. And then, so just some daily effects. It really ensures that the patient is still the center of the treatment session and that we're still taking the time to think about why we're doing this and tailoring it to all these unique patients. So like I said, this is going to be a 4-part series. So this is part 1, just kind of introducing the topic, and then part 2 will be how to set up a treatment session based on this idea. But I'm just going to give you all a sneak peek to start with. So the treatment paradigm kind of goes in this order of 10 steps. Your first step being your evaluative step, figuring out what those asterisk signs are for this specific patient. A treatment session might start with manual, and then you could reinforce that with motor control exercises, always reassessing after you perform every exercise. And then you can move into functional warm-up, speed, agility, and power, strength, metabolic conditioning, motor control, and then always end with a cool down and then reassessing those asterisk signs. So that completes part 1, just a little quick intro. Stay tuned for part 2 on how to set up your session.